MST is based out of Redmond, Washington, right? But our reach is way beyond that.
So MST focuses on distinct clinical areas of need. We solve problems for surgeons. Many of the MST devices are built around surgical issues that are somewhat routine that a surgeon might face in everyday cases. And we want to make meaningful devices that make those difficult situations simpler.
We make products that surgeons love. The tagline is for surgeons by surgeons, which makes us unique. They tell us what they want, we can make it.
Nobody understands devices that are used in surgery better than the surgeons themselves. So I think surgeons, when they're designing the device, they offer a unique perspective that an engineering team by themselves wouldn't be able to understand.
We have a very well-trained field team that is intimately involved in surgery with the community on a daily and weekly basis, so we are constantly receiving feedback as to what's working great, as to what can be improved upon, and that leads to further ideation and new product ideas as well. So it's a constant iteration.
These ideas come to us from surgeons. As you look at the MST portfolio, many of the devices that are in our product offering have a surgeon's name attached to them. Boris Malyugin, David Chang, Ike Ahmed, some of the great surgeons from different places in the world have come to us with ideas and said, hey, MST, I have an area where I can make surgery better. MST, I have this problem that I want to solve. And so that hand-in-hand partnership allows us to really meet the surgeon's needs and make sure that we're bringing high-quality devices to market.
I'm delighted to share some of my experience with one of my favorite companies, Microsurgical Technologies. I've been working with them off and on for many years, given that they've always had this focus of perfecting or offering devices and solutions for our most complicated and difficult cases. We all know about the success of the Malyugin ring. Larry Lack's working with Boris to really perfect that delivery system. All in all, this has been a company that I think has filled a really important role for anterior segment surgeons throughout the world by focusing on sort of unmet needs that maybe aren't the most common products that we use, but we sure depend on them, and we wouldn't be able to do what we do without them.
MST was just the right size company, that I think finds that right balance to be able to give people the attention, but still strive forward to do things at a big scale level. And I think they've always been that way. They've always been about, I think not about the dollar, not about the show, but about, designing things that people really love to work with and are devoted to use, and put the right tools in our hands to do magic, and create magic in the surgical field. I think that's what the partnership has been. I still come to MST, and that's probably the only place where I sit down, or stand at a table, and we've done this many times, bring a piece of paper and start drawing ideas around. Many ideas don't go anywhere, right? But one idea may stick, and it goes forward. And MST's been the company that's been able to partner with, and not just because maybe I've been a name for myself, but because you don't have to have a name even. We've been doing this since I didn't have a name in the field even, right? So it's been an incredible part. For me, it's really, honestly, not just saying this, it's been one of the real career highlights for me.
So what I really love working with MST is that they're never satisfied with their work. They always are good with feedback. Malyugin ring 1. They say, let's make it, the shoot scrolls, let's make them bigger. Let's make the material thinner, let's make it better. Trabex Pro, the sleeve, let's make it 1/4 millimeter smaller, fit into the incision easier. They'll do it, they'll take it back. Arcto, everything they do, they're obsessed about making surgeons happy.
I really can't imagine my day without the MST instruments. It's really an extension of my hands into the eye. And when I think about what I want for my patients, it's safety and efficiency. And so really having a company that listens to the surgeons, that's for the surgeons, and ultimately really for the patients and patient outcomes is something that makes me proud to work with MST and proud to be a part of the ophthalmology community in general.
One of the key advantages I find that using instrumentation designed by surgeons is all of the experience in actual real-world surgery and all of those fine details that really only a surgeon would think of really helps improve the instrumentation in a way that sometimes I myself don't even really think of until I'm actually doing the case. And then I think to myself, wow, whoever designed this instrument, that was a great idea.
MST has a long history of bringing innovation to anterior segment surgery. Certainly we've used the Mayugan ring for a number of years, and it continues to evolve and get better and better. And it's become an easier device, a safer device. It's really become an essential part of those of us who do somewhat difficult cataract surgery.
There's only a few companies who I would say have been very influential in my career, and the number one company is going to be Microsurgical Technology. Very shortly after my fellowship, I was in the operating room and I was trying to build my career doing complex cases, and my MST rep came in the room. And he brought with him an instrument set and said, hey, look, I see what you're doing. I think I have some solutions that may help you do your job better and easier. And there was absolutely no reason that anybody would have needed or really wanted to take interest in what I was doing, but MST did.
One of the things I love about MST is their commitment to sustainability. Waste produced in eye care is a huge problem globally, and we need industry partners that are willing to partner with us with organizations like iSustain to reduce this waste. And it makes us really happy to know that we have industry partners that are willing to help us in this. I personally feel that when I have somebody to call at MST, that my voice is heard and I'm able to talk to them about my issues, my needs, and my ideas for the future. I just really feel like this is a company that listens to physicians and takes their ideas and moves forward with them in the ophthalmic space.
Working with surgeons that are the best at what they do dovetails really well with working with our operators that are the best at what they do. We're getting designers and some of the most brilliant physicians to give us their very best ideas, and we get to work with our operators to turn those ideas into reality.
You know, good thing working in here is in many ways I can help people. That's my from here all the time. In the morning I get in here, I help people. How many people can I help today? How many products that we deliver, that kind of things.
Well, the MST, I can say there's a special place to work. So we are like families in here. We tie together as a team, strong, working really hard. You know, our product is we make by hand. Like I just say a product to help the people can see.
I think what energizes me is like we have two sets of heroes, our surgeon partners and our patients and our employees. And it really is about I really believe in a system. If you empower employees, you give them accountability as well as authority, they'll create something that's going to really affect the patients and the surgeons, and that's what we see every day. That's what excites me about bringing a change in this world.